My name is Rizwan Bukhari. I'm a vascular surgeon. I went vegan and plant-based in 2017, and I initially did it for my health. It's an interesting story. My wife has been pretty much plant-based and pescatarian for most of her life, and then she became vegan a little bit before me. Around 2017, there was a guy named Rip Esselstyn, so I imagine many of you have heard of him. He was coming to town to speak at a Whole Foods, which we actually lived next to the Whole Foods, and we'd moved there because we wanted to be next to the Whole Foods so we could get healthy food. And so she dragged me there to see him, and I say dragged because I wasn't all that interested in going to see him. And during that talk, I heard him talk about things like chronic disease and how the foods we eat had an effect upon that. But something that really got to me was he talked about how you could reverse heart disease. And that kind of got my interest, and not necessarily in a good way, because I'm a vascular surgeon. I deal with cardiovascular disease all the time. And this is the first time I'd ever heard of something like that. And so I was thinking, who's this guy telling me you can reverse heart disease when I personally, being an expert in the field, had never heard of such a thing? I walked away from that talk not necessarily believing what he had to say, but having heard something I had never heard before. And it did introduce a bit of, kind of interest in my mind. And over the next few months, I did do some research. I learned a little bit more. I read his father's book about how to prevent and reverse heart disease, the one by Caldwell Esselstyn. And then I read the China study by T. Colin Campbell. And at that point, I had started to really begin to understand food and disease in a different way, and in particular related to my particular specialty, vascular surgery and cardiovascular disease. What I liked about what I was reading and learning is that this was evidence-based information. It was based on scientific fact. It wasn't some sort of fad. At that point, I actually made a personal decision to change the way I lived and the way I eat. And I transitioned slowly over a few months to the point where I became completely whole food plant-based. I also started to incorporate that concept into my medical practice and started to teach my patients about whole food plant-based nutrition and how it can improve their health.
How long have you been a vascular surgeon?
I've been a vascular surgeon since 1998.
There's never been any mention about this sort of thing?
That's what I find interesting, fascinating, and a little bit disconcerting. And I can speak to that a little bit in the sense that I finished my vascular fellowship in 1998. I did 2 years, and it was a very intensive 2 years, and it was scientific and it was clinical, and there was a lot of research. I'm literally considered an expert in cardiovascular disease, in atherosclerosis. It's the disease that blocks off the arteries. And so I finished in 1998, and I had never heard of such a concept of preventing and reversing atherosclerosis. Literally, we came to believe that it was a natural part of aging, that there were risk factors that people had, and that you would get the disease, and then come to me once you get the disease, and I will help you treat the disease. But when I started to do the research about plant-based nutrition and starting to understand about how you can prevent it from occurring and how you can even reverse it in some circumstances, I started to learn about the work of Caldwell Esselstyn. I also learned about the work of Dean Ornish. And that was particularly impactful on me because Dr. Ornish was doing his research in the late 80s, and he published in the, I think his first publication that I'm aware of was in the 90s on how to prevent cardiovascular disease. And so I finished my fellowship 8 years after that, and yet despite the fact that that research was published and relatively well known, it was not presented as information to me during my formative years as a vascular surgeon.
So they don't talk about prevention at all?
No, prevention is not necessarily a concept that's focused on in our training. We really are taught how to treat the disease once it occurs, and for me that goes back to how the Western model of medicine started. The Western model of medicine started a little over 100 years ago, and it was meant to treat acute diseases and illnesses. So if somebody got injured or if somebody got sick, they went to the doctor and the doctor addressed that issue. But if you fast forward 80 years or 100 years or 120 years from when this model kind of first developed, the disease processes in our country and in the world have changed. We're not dealing with acute injuries anymore, which are the major issues. Now we're dealing with mostly chronic disease. 80% of what we take care of is chronic disease. Yet we still treat the chronic disease with the same acute care injury model. which instead of teaching people how to prevent getting that chronic disease, we wait for them to get the chronic disease and then we treat it. And we treat it with a bunch of surgeries, we treat it with a bunch of pills. For me, part of my metamorphosis or my change in my understanding was that I understood that I was what I call plugging holes and putting out fires, but I wasn't really affecting the underlying disease process. I might bypass a blockage, but the disease process that caused the blockage still existed in my patients. And that was really fascinating to me, and also very gratifying to me once I was able to understand that and change my approach. I do have to help fix my patients when they have these major advanced problems, but I can also help them learn how to lessen the impact of their disease and get, do better.
So let's get back to you for a second. You went plant-based, or could you say vegan?
Well, yes, actually. So that was part of my story too, is that I initially did this for health reasons. And actually my story is a little bit more involved than that. There was also a personal aspect. I've always been very interested in my own health. I've always exercised. I was a big runner when I was younger. I would run 25, 30 miles a week. I also lifted weights. I maintained a very lean body mass. I ate lean meats, what I thought were healthy meats. And yet, despite all that, in my late 40s and early 50s, I had started to develop prediabetes. I was prehypertensive. My cholesterol was high, despite all of these things that I was doing. That also had an impact too on me making the change when I learned this new information. And literally within about 3 or 4 months of changing my eating habits, from going from the standard, and I wouldn't even call it the standard American diet. I ate probably a healthier version of the standard American diet. But going from that to a whole food plant-based lifestyle, all of those things went away. I was heading in the same direction as most Americans, that by the time I was 50, I was going to be on some medications for some chronic disease. And all that changed when I went whole food plant-based. So yeah, initially it was for my health. As I often say, what happens when people kind of get into this space, I call it, I was very conscious and aware of the health consequences of the change in diet, but then I also became more aware of things about the consequences to animals and the consequences to our environment. So I very quickly became an ethical vegan as well. And so today, 5 years later, 6 years later, I consider myself whole food plant-based for my health, as well as a vegan for animals, as well as an environmentalist. And I really think that all of those things, they fit in very well together.
Were there any other physiological, mental, or emotional changes that came with this?
Well, I think that, I did feel better. You notice things about just kind of feeling better, sleeping better, a lot of kind of your chronic issues. Something I remember very distinctly is that I used to take ibuprofen all the time for chronic headaches and chronic joint pains, and I didn't need to do that anymore. So I think that there were some kind of general, overall well-being changes as well that I felt from it.
Are you okay with using the word vegan?
I am. I think that there's a thing that I like to make a distinction on. There can be people who are whole food plant-based who aren't vegan, and they are specifically into it for their health. I actually think it's kind of interesting when someone says, well, I was vegan for a couple of years. And for me, I want to make clear, being a vegan is an ethical standpoint. It's not even about the diet. It's about your stance on how we treat animals and how we, treat animals in our world and what our thoughts on all that. For me, being a vegan is an ethics thing. Okay, the diet isn't a consequence of that. Okay, but it's also everything about how you treat animals and your attitude towards it. I do clarify, I am a whole food plant-based person, and I am an ethical vegan. You can be an ethical vegan and not be all that interested in your health, okay? And there are people who say that, and that's fine because that's their choice. So I do think that there's a distinction to be made.
Panacea. Some people that are vegan and also eating whole plant foods, they might still encounter some chronic diseases because veganism maybe necessarily isn't a panacea, right? How can you defend this way of eating in the context of somebody who still gets diseases?
Right. And I think that's a good thing, a concept to understand, is we're trying to teach people, or I'm trying to teach, and many of us who speak the same concepts as me are trying to teach people a healthier way to live. But the honest reality is we all are going to die eventually. And some of the things that I teach are I'm trying to teach people a healthier way to live so they have a longer lifespan, but that they also have a longer health span so that they live a longer, healthier life. And this came about because I see that my patients who are in their 50s and 60s, they're spending the last 15 and 20 years of their lives with chronic illnesses, taking lots of pills, spending a lot of money on their health, and not really enjoying their older years. They're dying earlier. I even say this concept that they're busy dying, they're not busy living. When we teach the concept of a healthier lifestyle, which I do through a whole food plant-based nutrition, I'm hoping to be an advocate to help them live longer and healthier, but we all eventually succumb to some diseases. It's not a panacea in the sense that we're going to live this utopian existence where we never die. Something's going to get us in the end. One thing I quote, for example, and I try to stick to where I'm an expert, and that's in cardiovascular disease. About 40% of Americans end up with cardiovascular disease. That's a significant number of people. And I think the number that succumb to some sort of sequela from their disease is in the upper 20%. That's very high. But if you go whole food plant-based, and if you can get your cholesterol down and you eliminate your other risk factors, your likelihood of getting cardiovascular disease is 5%. So you've dropped from 40% to 5%. There's still a risk, and if you live long enough and you develop the things that you might still have a heart attack, but hopefully it's going to be when you're 90 or 95 and you've lived a longer, healthier life, rather than getting that heart attack when you're 62 years old. So it's not a panacea in the sense that you eliminate all risk and all causes of death, but we're hoping to help you live longer and healthier by teaching this.
What are some of the other variables that might contribute to this? If somebody is eating perfectly and they still get this, what could it be?
Yeah. So why would people still get issues or have issues even when they're living a healthier lifestyle? And I think that's where genetics does come into the picture. Okay. And I don't want to overplay genetics. Genetics does not determine everything about our outcome. I think to give it some background, genetics kind of lays a framework, but then on top of that, the way we live our lives turns genes on, turns genes off, and has a tremendous impact on the diseases we develop and when we develop them. So genetics does not completely determine our lifestyle. Okay, but at the same time, if people are living a relatively healthy lifestyle and they continue to have some particular problems, there might be a strong genetic component that's influencing that. And again, in my field, that might be having something to do with triglycerides, or it might have something to do with cholesterol. People can continue to have high cholesterol and high triglycerides even on a whole food plant-based diet. Now that's pretty rare because 95% of people who go on a whole food plant-based lifestyle will reduce their cholesterol to less than 150. Okay, but there is still some whose cholesterol doesn't go that far, and then they may have a genetic component that's impacting that. I try to work within the framework of nutrition as well as medicine. And so for patients of mine, for example, who continue to have a high cholesterol after making diet changes, I will put them on a statin. So I think statins are beneficial.
For certain select people.
Absolutely. I think the first line treatment should be diet and lifestyle changes. But if that doesn't take care of the entire problem, then a statin is certainly something to consider.
I've heard that as you age, it's good to have your cholesterol maybe go up a little bit. Is that true?
No, actually, I believe that keeping a low cholesterol is extremely important in minimizing your risk of cardiovascular disease. And so again, a whole food plant-based lifestyle lends to that. You're not eating exogenous cholesterol, which comes from animal products. You're not eating high levels of saturated fat, which also leads to high cholesterol. And then also a high fiber diet, which is consistent with the whole food plant-based diet, also helps with your cholesterol. So no, your cholesterol your goal for your cholesterol should be to be less than 150 for the course of your lifetime.
What is the mechanism of action when you consume exogenous cholesterol that's causing this? Is it oxidated? What's going on there?
So I don't know that the exact process is elucidated, but what I can tell you is that I don't believe we were ever meant to eat exogenous cholesterol. In other words, our body makes all the cholesterol we need. And for vegans, for whole food plant-based people, we don't eat any cholesterol. And yet our body makes the cholesterol we need for hormones, for cell membrane stabilization, and for other processes. And so there's no such thing as a cholesterol deficiency. And so the whole concept of then us eating cholesterol that from the outside that we weren't meant to, I think the body processes that differently. And then that cholesterol becomes deposited in the arterial walls along with the saturated fat and is a part of an inflammatory process that gets out of control and then leads to plaque buildup.
And now there's different particle sizes, right? Talk about that a little bit, and is there any genetic component behind some of that, and is there any mechanism of action that's clear behind any of that as to, big particles versus small, or anything there that might help illuminate a little bit to people what's going on?
Yeah, and you can break down the cholesterol into different particle sizes and different types. There's lipo little a, and there's very low density lipoprotein and some other different things like that. And that is breaking it down into kind of an even more components. I think in general for most people, it's better just to look at the bigger picture and you don't have to break it down. For most people, just the concept of not eating exogenous cholesterol and eating a healthy diet and getting your general overall total cholesterol to less than 150 and your LDL to less than 70. And I think that many places say LDL less than 100, but I believe you should try to get your LDL less than 70. Those two simple concepts result in good health and good arterial health for many, many people. That plus other aspects of a healthy lifestyle. Now, when you get to the point where there's people who do all these things and those changes don't occur at the biochemical level and biochemistry level, then it might warrant looking at some of the other things. And you and I have talked about lipo little a in particular, and there's not a lot known about that, and there's a lot of research being done into it, and there's not a lot known about what you can do to reduce that, and there's no good strong medications right now that can be taken to impact that. But that also affects very few people, so it doesn't apply to the great majority of people that we look at.
What about some other things like trimethylamine oxide and like even saturated fat? People say, oh, well, that's outdated. It's no longer like an issue. But yet there's different saturated fats. There's short, medium chain, long chain. What are your thoughts on some of those different things that might contribute to this as well?
I strongly believe that saturated fat in most forms is strongly correlated with cardiovascular disease. And we know that high intakes of saturated fat lead to increased cholesterol as well. So I'm a big believer in eliminating saturated fat and focusing on the good fats, the unsaturated fats, and the polyunsaturated fats, which we know we can get from healthier fat sources like nuts and seeds, avocados, for example, and olives, and from whole plant foods. Most of the bad saturated fats and the cholesterol come from animal products. So again, that's where eliminating animal products and eating a whole food plant-based diet is a heart-healthy approach. My approach is scientific, and the preponderance of the evidence points to that saturated fat intake is bad for us from a health standpoint. And I think people can always cherry pick and say there's this study that said this or this study that said that. But again, you have to go with the preponderance of the evidence, and I still think the evidence today shows that saturated fat intake is bad for us.
So some doctors advocate maybe reducing like nuts and seeds that are otherwise healthy for a healthy individual.
Yeah.
And this really confuses some people, like Dr. Esselstyn, for example. I have a couple of people whose testimonies were, I just had to remove nuts or reduce them, remove oil, things like that, but without going into oil yet. Is there any need to be fearful of nuts and seeds?
Even within the whole food plant-based world, there's going to be a variety of opinions or a spectrum of opinions on different things. And the whole fat and oil and nut seed issue and then the intake is something where there are different beliefs. And the way I reconcile that is that I look at what the particular needs of the individual you're discussing about. For example, Dr. Esselstyn comes from an approach where he does not want people to use take in any fat and oil whatsoever. So no nuts, no seeds, no avocado. And the idea behind that concept is what he was treating is people with advanced heart disease already. When you've already got that advanced heart disease and you've got those bad blockages, and in particular, his book and some of the studies that he's put out there, he's addressing people with advanced disease. If you've already got the advanced disease, you need to do everything you can possibly do to arrest it, stop it in its tracks, and now try to reverse the disease. So his approach involves eliminating all fat intake. I can see that. On the other hand, if you're talking about a 30-year-old who you're trying to teach a healthy lifestyle, and they haven't developed the disease yet, and they live a healthy lifestyle their entire lives, and taking in a reasonable amount of healthy nuts and seeds and a reasonable amount of healthy avocado, for example, then they're not going to get to the point where they had to eliminate it all in their lives. That's how I reconcile it. You can have the one camp who says it's okay to have a reasonable amount, and then you can have the one camp that is looking at this disease process from the other direction, saying, look, we need to eliminate it all if we're trying to help you here. So that's the way I look at it. For me, from a healthy diet standpoint, I do think that it's important to take in some reasonable amount of nuts and seeds and healthy fats. Yeah, we need some fat in our diet.
And these can be protective, right?
Yes, I mean it's an essential component of our diet. We need fats in our diet. The approach I take, and from a whole food plant-based lifestyle, is that fat is about 10% of our diet, okay, as opposed to the standard American Western diet where it's 25, 30, 40, even 50% of some people's diets, and that is an unhealthy amount of fat. That leads to disease processes.
What about oil?
So oil is a fat. To me, there's not a distinction. I'm not a big fan of oil. Okay, all oil is the most highly processed aspect of where you're getting it from, whether it's a nut oil or a seed oil, or it's an avocado oil or olive oil. You're taking all of the other components of the food out and just results in the oil, which is fat. There's no nutritional value to it. It's pure fat. And so I'm not a big fan of it. There's some people who believe you need some, maybe for cardiovascular health, or you need some for brain health. And I think that those things are still being elucidated, and more studies are necessary. And those may be difficult things to tease out and understand. But we've got a long ways to go before we fully understand all that stuff.
So when we're talking about fat, we have to talk about the two essential fatty acids. It's my understanding it's better to get it like maybe a little bit throughout the entire day instead of all at once. Maybe eat with each meal to help absorb nutrients, things like that. How might a person look at this practically and implement it in their life, like in each meal?
So, the way I approach fatty acids is I talk about the omega-6s and the omega-3s. There's conceptually, omega-6 fatty acids are the more unhealthy ones. They're the ones you get more with the processed foods and high-fat diets and meat diets. The omega-3s are kind of the healthier ones. And there's a ratio that you want to achieve within the body, and that's about a 3-to-1 ratio of omega-6s to omega-3s. The problem with the standard American diet is it's so high in omega-6s and so low in omega-3s that ratio is 20-to-1, 25-to-1, 50-to-1. And that's an unhealthy ratio that we are aware of. The way to bring that ratio down is, number one, by when you go plant-based, you don't get as much of those omega-6s, so that ratio automatically comes down. And then I look to plant-based sources for omega-3s. There's people who talk about getting your omega-3s from fish oil. Okay, well, again, I don't advocate eating meat or using fish for your source. And in reality, fish actually get their omega-3s from eating algae. So the fish are just nothing but a intermediary. So you don't have to eat the fish to get or the fish oil to get your omega-3s. You can actually get it from algae. The other good sources for omega-3s are chia seeds, hemp seeds, flax seeds. I use flax seeds more than anything else, ground flax seeds, walnuts. Those are really very good sources. And so what I do is throughout the day when I eat my meals, if I make a green smoothie, I put ground flaxseed in it. If I'm having a salad, I put ground flaxseed on my salad, and I also put walnuts on my salad. And so I find different ways to incorporate those omega-3 sources into my diet throughout the day. And so that increases my omega-3s. And then, of course, you reduce your omega-6s by not eating those sources, and your ratio becomes better.
Sometimes we hear that we don't sufficiently elongate the fatty acids into DHA or EPA. I'm sure you've heard of that. Like, we're not very efficient converters, just like fish aren't very efficient converters, right? But they're immersed in it so much that they get enough. I heard recently, though, if we weren't capable of doing it, we would just be dead. So does anybody really need to be worried about not efficiently converting or elongating those fatty acids?
To speak to that question, are we, you mean we as vegans and whole food plant-based, are we efficiently utilizing these fatty acids? And I've seen some studies that say that our levels are lower, and that may be a consequence of the diet we choose. But I've never seen anything that shows that there's a clinical significance to that. So people aren't dying from the consequences of that, and therefore, nor are they having any clinical sequela. So it may just be that we have lower levels as a result of the diet we choose to have, but it's not having any negative clinical significance.
Now, some doctors say that they've treated people, though, that were vegan for a very long time, and they got neurodegenerative diseases. Have you heard of anything like that?
I'm not aware of that. And again, that might be just kind of the anecdotal story or the one-off, and so I don't know how you could. I point to the fact that I'm very science-based, evidence-based. I practice evidence-based medicine. There's a lot of science behind what I talk about. The one-off stories, they don't necessarily mean anything to me.
Dr. Joel Kahn talks a lot about trimethylamine oxide. Talk about that a little bit. He didn't really elaborate on maybe mechanistically what's going on there.
It's interesting. So we talk about a few things that are very commonly known. We talk about cholesterol and saturated fat as being risk factors for atherosclerosis. And there are other pathways that exist as well, that have to do with the way we prepare our food or for the foods we eat. TMAO, or trimethylamine oxide, is considered to be something that is, with increased levels, you have an increased risk of atherosclerosis. And that is increased in levels in people who are meat eaters. And that comes from the carnitine and the choline in the meat that we eat. What we've seen is that in people who are whole food plant-based, they don't take in the carnitine and the choline, and therefore they don't make the TMAO. And so their TMAO levels are lower. So that there's the thought process there is that reduces their risk for atherosclerosis.
Does that have to do with inflammation?
What I think it has to do is with the gut microbiome, okay? Because it's the microbiome that helps convert the precursors into TMAO. Vegans, whole food plant-based people have a different gut microbiome, and so therefore they don't convert to TMAO.
Yeah, but does this end up in our bloodstream and cause inflammation there?
The TMAO?
Yeah.
Oh, yes. So the thought is that it enters our body and in our bloodstream and is a contributor to the development of atherosclerosis. I don't know the exact, at the molecular level, or what exactly happens. The thought is that it increases atherosclerosis. Atherosclerosis itself is inflammation at a molecular level. The way I describe it to people is think about getting a splinter in your thumb. It's tender right at where it happens, and then a little area of redness occurs around it, and that's inflammation. And inflammation is actually the body's normal response to an injury. And so what's happening is the body's recruiting these inflammatory cells and inflammatory hormones to come to this site of injury and to try to heal it. So you take out the splinter and healing occurs, and once healing occurs, the redness goes away and the inflammatory stuff goes away. Okay, that's a normal inflammatory response. But what's happening at the microscopic and molecular level within the bloodstream is an hyper-exaggerated inflammatory response. So an injury occurs to the blood vessel, whether it's cholesterol or saturated fat or maybe TMAO. It's recruiting at a molecular level. And by the way, diabetes doubles the inflammation level. So that's why diabetes is such an important contributor to atherosclerosis. But so at this molecular level, the inflammatory stuff comes in and inflammatory response occurs. There's swelling, Okay, think of it like swelling, the same way you might see swelling in your thumb with the splinter. But instead of healing occurring and all that stuff going away, the inflammatory response just continues. And it continues over the course of years and decades and a lifetime. And over that time, that inflammatory response builds up the plaque. That's a part of the inflammatory response. And then that plaque blocks off the arteries, and then you have the consequences of blocked arteries.
And then how do you measure for this? Is there a C-reactive protein or something? Is that what it is?
So we don't have a lot of good biochemical markers to measure for this disease. We typically understand it anatomically, either by doing studies like a CAT scan or an ultrasound or an angiogram, and clinically by symptoms. So the first symptoms oftentimes of blocked coronary arteries is chest pain or a heart attack. Or the first symptoms of blocked leg arteries might be pain when you walk, or it might be a non-healing wound that leads to gangrene, or a blockage in the carotid arteries that leads to the brain. The first symptom you might ever have, unless it's picked up by accident, is a stroke. So unfortunately, these are silent killers that are growing slowly, indolently over the course of your lifetime, and many times you don't know you have it until you have a symptom related to it.
So what is C-reactive protein?
C-reactive protein is a marker of inflammation. Okay. The SED rate is another marker of inflammation. Those are the two that we use the most. The SED rates can maybe a little bit older study. The C-reactive protein's a little newer study, but they're both useful in looking at kind of what's the general inflammation of the body. It's not specific to a certain area, like the blood vessels or the liver or anything like that, but it's a blood. You draw it out, you draw the blood, and you can measure either a SED rate or a C-reactive protein, CRP, and that we know what normal levels are, and they should be less than a certain number or close to zero. And if they're above a certain level, we know that there's some sort of inflammatory process going on.
I've heard a lot of people talk recently about their calcium score, and it's my understanding that's a sign of healing, right?
So a calcium score, and I think you're probably talking about the heart. Yeah, there's something called a calcium score. In particular, it's a CAT scan that's done, and it's looking at the heart, and it's a CAT scan that looks at and measures calcium, and so you can get a calcium score. Is it 0 to a few hundred? The higher your calcium score, that means that more calcium that's deposited into the arteries, your coronary arteries, the arteries of your heart. And there's some correlation with the higher calcium score has a higher correlation to blockages in the arteries. Not always, because calcium doesn't itself equal blockages, but calcium is correlated to blockages. You can also have a very low calcium score and still have blockages in your arteries. So it's not to use our term again, it's not a panacea. You have to take it in as a part of the big clinical picture. Okay, what it is a calcium score tells you how much calcium there is. Okay, and generally calcium is associated with more plaque, but not always. Calcium deposition into the arteries is a part of that inflammatory process. So we'll see people, when I take out so for example, when I'm cleaning out someone's carotid artery, and I take that plaque out, and I've got this big chunk of plaque, this plaque, it varies in its morphology. The vast majority of people, it's rubbery and firm, and that's the saturated fat, and that's the cholesterol, and that's the collagen. But then it can also be very hard and rock-like in some people, and that's the calcium. So the calcium deposition into the arteries or the walls of the arteries is a part of the inflammatory process. The actual number might vary based on where you have the study done, because it varies from study to study. In one institution, a 60 is a 60 versus 100, but in another institution, that 60 might be 100. So you can't just use a flat number. But but you can use these relative numbers for some idea. So if someone comes in and they're getting a calcium study, a calcium CT scan, and their score is 7, you can tell them you got a very low calcium score. It's not likely that you have bad coronary artery disease. But again, you don't take that isolated. You take that as part of the bigger picture. Clinically, are they having chest pain? Clinically, can they walk 2 miles without having a problem? Do they have shortness of breath? Yes or no? What's their family history like? You take it in the big picture. Someone who comes in with an intermediate score of 50 to 100, you might say to them, okay, this is a little concerning. Your number's higher it's not a low number. And so again, I might be more concerned and might want to look into your heart a little bit more carefully, especially if you've got some other stuff going on. Now, someone who comes in with a calcium score of 300, they're probably buying themselves an angiogram. Okay, so these are relative numbers, and there's not an exact. It's not a one particular number means one thing. You kind of take them in their ranges.
How does sugar, like processed foods or sugar, become a problem? Because processed foods are a problem, right? Why? Why are they a problem?
Processed foods in general are a problem because they're changing the whole food. Okay, you're changing it in some way. Or I look at processed foods in two ways. Number one, you're modifying the original food. For example, the extreme oil is the ultimate processing of the foods it comes from. You've taken everything out of it. Other processed foods are, you look at Oreos, for example. I like that example because they're vegan, but there's nothing milk-like or dairy-like about that filling. It's a completely chemical-based filling, And so for me, it's either you're not eating the whole food or you're eating some sort of chemical with a lot of preservatives. And so that's what processed foods are to me.
Are you familiar with some of these diets where they're just entirely animal-based, like the carnivore, keto, paleo? And what are your thoughts on that? Because they're getting some transient results there. Are those transient?
So my thoughts on kind of these, what you call meat-based diets. So you can say paleo or keto, for example, are a couple of those. And they're not based on science. Okay, they are in general more fad-like diets. The science out there doesn't support them, and I would consider them diets and not lifestyles. Oftentimes they're not sustainable. And then when you conceptually look at it, for example, we don't know the long-term effects, but you can kind of postulate years and years and years of exposing yourself to high saturated fat and cholesterol. We really do believe is going to be bad for your heart and for your arteries. Now, what I will say is that there is some transient short-term effects that are beneficial. And you could say that about any diet where somebody is focusing on their health, okay? Even the keto diet, they're talking about eating meat, but then at the same time, they're eating these healthy vegetables. Anybody who's focused on their diet is going to make better choices generally than somebody who's not focusing on their diet. So you will see transient benefits. And I'll give you an example with addressing type 2 diabetes. You can put people on a keto diet, you can put people on a plant-based diet, and if they both lose weight, both subsets are going to see improvements in their diabetes. But that diabetes improvement comes from the weight loss and not from the keto diet itself. Yet on the other hand, if you take people on a plant-based diet and you feed one group enough food that they don't lose weight, but the other group loses weight, guess what? They both improve their diabetes. So in that particular case, it's the plant-based diet which is improving their diabetes and maybe the weight loss as well. Whereas with the keto part, it's not the keto itself that's improving the diabetes, it's the weight loss. So you will see transient benefits. Of course, and anybody who loses weight, their blood pressure is going to improve, their cholesterol is going to improve. So I think that the benefits you see from people who lose weight on keto is due to the weight loss and not the keto itself.
The Seventh-day Adventist study, are you familiar with that?
Some aspects of it, yeah.
Yeah.
There's been a lot of work done out of the Seventh-day Adventists, so it just depends on what you're talking about.
Yeah. One of the things I hear that one of the Adventist studies that the vegans had better health outcomes, but they didn't live as long as the pescatarians. And I wonder if that's because maybe the vegans were just ethical and weren't as health-oriented, even though they were still, in the Adventists. But when they're pescatarian, maybe they're doing that for more health-oriented reasons. There's less ethical motive there. Are you familiar with any of that, and do you have any thoughts on that?
So, I'm not familiar with that, and I don't know the data. I'd have to really review the studies and look at the information in order to make any meaningful conclusions.
Do you at least concur that maybe somebody going pescatarian might be doing that more for health reasons than somebody just going vegan typically?
For an ethical vegan, for example, there's a whole spectrum of what they might eat. There is something called a junk food vegan. In one of my lectures, I have a slide where I point out that the junk food vegan is just barely a little healthier than someone eating a standard American diet. because they're eating a lot of oil, they're eating a lot of sugar, and they're eating a lot of processed vegan foods, a lot of fried foods. That's kind of the junk food vegan versus a whole food plant-based diet, where there's confers a 60-70% benefit over the standard American diet. So the vegan diet is a little bit better, but if it's a junk food vegan, it's not much better. So yeah, I mean, I think where you end up on that scale of what you eat has a tremendous impact on your health, and so your reasons for it. I mentioned to you earlier when I was mentioning that there are people who are ethical vegans, and that's their entire stance, and it's not about health. It might not even be about the environment, and so they will they're not concerned about the food they eat as much as long as it's not harming animals.
What do you think are the most absolute protective foods for your vascular system?
I'm a beans and greens guy, but I love greens, okay? And the reason I talk about greens is because they have the precursor for nitric oxide. And nitric oxide is my most important molecule. As a vascular surgeon, that's my hero molecule. And it's a very important molecule in the health of the arteries. Nitric oxide tends to prevent atherosclerosis from occurring. It's a vasodilator. It reduces your blood pressure. So it has a lot of beneficial effects. And nitric oxide comes from that inner lining of the arteries, that healthy inner lining. As we develop atherosclerosis and we break down that inner lining, we make less nitric oxide. And so one of the things we can do as we're aging, as we make less nitric oxide, and as we're developing atherosclerosis, is to supplement that with the diet. And so the greens is where we get that nitric oxide from. My favorite greens, arugula is one of my favorites because it has a really high nitric oxide potential. I like spinach. There's people who want to be careful about how much spinach they take in. There's concerns about kidney stones, yeah. And I think that you have to take that with a grain of salt, and it's relative. But any greens, beet greens, collard greens, chard, romaine, yeah. But my favorite is arugula. Almost every day I eat a spinach and arugula salad, and I top it with onions and beans and nuts and flaxseed and some fruit, and so the funny thing is we call it a salad, but it's only called a salad because there's some greens in it, and then I just use it as a means to get a whole bunch of other stuff in it. But again, those greens are really important to me. If you look at Caldwell Esselstyn's work, he had his patients take in 6 servings of spinach a day.
Spinach?
Yes. The reason for that was to get that nitric oxide. Okay. So that was an essential component in trying to reverse their heart disease. So again, the greens are my favorites.
Now, I'm not a nutritionist or a dietitian or anything, but when I'm telling people what I think, I try to say get as much variety in your greens as you can because of the oxalates in the spinach. As a general rule, 6 servings of spinach, is that not maybe necessarily a good thing?
Well, so I tend to believe that this concern about oxalates in spinach and causing kidney stones has been blown out of proportion. It's a concern you need to be aware of, that possibility exists, but it probably affects a very, very small percentage or fraction of a percentage of people. And so therefore, let's just say it affects 1 in 1,000 people, are you telling 999 people that they can't eat spinach because of that one person? So again, you have to take the clinical picture into it. Did they have kidney stones before? Do they have a propensity towards it? Well, then sure, eat those greens that don't have oxalates. Okay, minimize your spinach intake. So, and yeah, there's nothing wrong with a variety of greens. So yeah, that's why I say eat lots of greens, but you don't have to eat particularly spinach. That's just my choice. Again, my favorite's arugula, but I eat arugula, kale, I eat spinach, I eat romaine. Those are my favorites. Those are the ones I tend to buy the most. But yep, I tell people, if you like collard greens, go eat those. If you like Swiss chard, eat that. But just get your greens somehow.
It wasn't really the kidney stones that was an issue for me. Knowing somebody who's anemic was eating a lot of iron-rich foods, so they go to spinach, and then the oxalates inhibit the absorption of of the iron. So, staying away from tannins and the heavy oxalate foods was just recommended
Yeah.
for that individual.
Right, and again, that's an individual case where they had a particular process that impaired it, but it doesn't apply to everybody in general.
Somebody may have cardiovascular disease issues in a variety of ways, right? They might have an enlarged heart, leaky valves. They may have the widowmaker. What is plant-based the most effective at?
When we talk about the diet and how it affects the heart, the most common thing we're talking about is how it affects atherosclerosis or blockages in the coronary arteries. And there are, of course, many other types of heart problems. There's heart failure, which is an enlarged heart. There might be leaky valve problems. There can be septal defects. So there are other heart issues. But the one thing that, when you talk about heart disease in general, that encompasses multiple entities. But what I particularly address is atherosclerosis. The whole food plant-based diet impacts atherosclerosis the most. Okay, that's where you can slow down the progression of atherosclerosis or even halt and reverse it with aggressive treatment. Now, there are some studies out there that show that a whole food plant-based diet can help with some of the other things. And again, this is early information and there's not a lot of it out there. There's some studies that show that a whole food plant-based diet can help with heart failure. Heart failure is when your heart isn't pumping very strong, and so it doesn't pump the blood as effectively throughout the body, and people can become short of breath. Heart failure involves enlargement of the heart as well. So there's some early studies that say that a whole food plant-based diet may help that to some extent. There's also some stuff out there where you've heard that people with rhythm problems, you've heard of atrial fibrillation. There's some stuff out there that atrial fibrillation may improve with a whole food plant-based diet. But I think, again, I wouldn't lay my money on that yet. We're talking about early on and we don't know for sure what the impact is, and a lot more studies are necessary. So again, when we're talking about how the diet impacts things, we're talking mostly about atherosclerosis, specifically blockages in the coronary arteries.
Are there any new breakthroughs with heart disease?
I don't know about the scientific breakthroughs as much as I think that our technologies are always advancing on how to treat different diseases of the blood vessels and heart. The last decade to 15 years have been especially exciting for me because I've been involved in this field during a time of tremendous innovation in some of the procedures that we can do and things that typically patients might get major operations, big long incisions on their legs or their neck or their belly, or even having their chest split open. And now we can do lots of treatments through minimally invasive procedures, which aren't just stents, but valve replacements. And now I don't do bypasses of the legs nearly as much as I used to because I can do so much through puncture-based procedures. So I see a lot of technological breakthroughs and advances, and that's continuing to occur. Now, on the physiologic standpoint, we haven't seen the same kind of breakthroughs. So we haven't gotten to the Star Trek point yet, where we can just wave a wand on somebody and suddenly we fixed a few things. Back when I was in medical school in the 90s, we were talking about this thing called the magic bullet. And it was where we thought we were going to be able to attach some medication to a monoclonal antibody. And that monoclonal antibody would be able to attach itself to the plaque. So you just inject it into the person. And that monoclonal antibody will go everywhere there's plaque in the body and attach itself to the plaque. And that medication that's attached to the plaque would then dissolve the plaque. Okay, so there's your panacea. And we've been talking about this since I was in medical school, early on when, as monoclonal antibodies were being developed and these magic bullet concepts were being developed. And here we are. I was in medical school from 87 to 91. Okay, a long time ago. Oh, that's 30 years ago. And 30 years later, fast forward, we haven't developed that magic bullet yet. No advanced medicine treatments and physiologic treatments to make plaque go away. And the reason I bring this up is because we already have the answer. We already know how to prevent this plaque from occurring, and that has to do with your lifestyle and the food choices that you make.
Except for in the rare case where it's genetic.
Sure, except for that. But for the vast majority of people, we know that for 80% of the chronic diseases out there can be prevented through changes in your lifestyle.
Explain the advancements of stents and bypass surgery.
It's not a recent thing. Stents have been around now since the 90s, and stents have, in many places, largely replaced bypasses, whether it's in the heart or the legs, in the kidney arteries, intestinal arteries, even in the neck sometimes. So there's oftentimes where stents can be used to open up an artery instead of doing a bypass. So it's far less invasive and a much better experience for the patient. What I will say though is typically stents don't last as long as a bypass would last. So there is a trade-off and a balance that you're trying to achieve. It's, the length of effectiveness of a stent is less, but it's less invasive, so it's a better experience. But they might require more procedures in the future. Whereas if they had a bypass to start with, that'll last longer and they might require less procedures in the future. So these are part of the decision making we make every day when we talk to patients about whether they're going to elect for a stent versus a bypass.
So the last question on this lipo-a, is there any hope in the future for something other than maybe pills and stenting and a bypass, or is there anything you're aware of in respect to that?
With respect to lipo-a, I'm not, I don't know exactly what's on the horizon. I know a lot of research is being done. They're looking into medications that might be able to be developed in order to specifically address that. So there's nothing that exists right now that's a definitive treatment for it. Although we do know that lifestyle changes tend to impact it positively. I don't know if there's anything on the horizon.
Children, I've heard as young as like 10 years old, even younger, even prenatally, have been shown to have heart disease or atherosclerosis due to the mother's lifestyle. Would you say that eating whole plant foods is the most protective for children?
This all goes back to my education about atherosclerosis. We often think of it as a disease of older people because who do you treat? We're always treating people who are 60 and 70, 80 years old. And so oftentimes the concept exists out there that it's not a problem for younger people. Okay? But what we do know now is that atherosclerosis is developing throughout the course of your lifetime. There were some studies done on Korean war vets where the unfortunate individuals who were killed in action, they did autopsies on them. And I think the average age of these young men was in the early 20s, maybe 22 years old. And what they saw was that 78%, nearly 80% of those 22-year-olds had some evidence of atherosclerosis in their bodies. Now, it wasn't major blockages, but it was certainly the early signs, the beginnings of atherosclerosis. And so that was kind of an indication that it starts at a young age and that it develops slowly over time, and then it becomes clinically evident when we're older. To me, that tells you that our diet and our lifestyles at that age is having an impact, and we're starting to deposit that plaque in the arteries. Interestingly enough, as we fast forwarded to more modern times with more modern imaging techniques, we're seeing, and then also in autopsies in younger kids, puberty age and even prepubescent, we're seeing that there's evidence of fatty streaks, which are microscopic plaque in the artery. We're seeing evidence in those younger people. A colleague of mine, when I was watching her do a lecture, she's a MFM, maternal fetal medicine specialist. She pointed to a paper in her lecture where there's evidence of these fatty streaks in utero. Okay, so they're occurring in the baby that's developing in the mother's womb. And that then is directly related to what the mother herself ate. Okay, so we now know that this is developing over the course of a lifetime, even from the time we're born. Taking all that into account, in my opinion, and the opinion of many experts, the best way to prevent atherosclerosis from occurring is to eat a whole food plant-based diet from early on.
And this is a question I really want to ask, but you probably don't want me to ask.
Well, I'll tell you an answer. We'll see. We'll decide if it's going to stay in the video or not. Yeah.
And that is, so if it's more protective to raise your children on whole plant foods exclusively, I mean, doesn't that imply pretty explicitly not doing so is kind of abusive?
Yeah, that's a good question. I wish I could call it that black and white. Unfortunately, nothing in our world is that black and white. I'm not playing a blame game here. I'm trying to educate people on what I think I've learned and what I think is the best way. And when I look at our world, everyone out there is exposed to our culture, our social circumstances, advertising from a very young age. Well, the way many people learn to eat is the way their parents help them eat and their families help them eat. And so they learn these things, not only what their parents fed them, but what they're seeing on TV and the fast food places right around the corner. And so this is how people grew up. And so there's a particular mindset around that about what is normal to them. And when you grow up that way over the course of decades, it becomes very ingrained into your psyche. Okay, so it's not even a question of what's right and wrong, it's just what's normal. I do believe that the best way to raise somebody is on a healthy, whole food, plant-based lifestyle. But they don't necessarily believe it because they weren't raised that way. I don't call it a black and white line, well, you're abusing your children and you're murdering your children. And what I try to do then is help educate people. That's why I put the word out. And I just keep putting the word out. And maybe someday, just the same way Rip Esselstyn planted a seed in my mind, maybe I'll plant a seed in somebody else's mind for that seed to grow and flourish, and then they can learn more and change the way they do things.
Perhaps I should have framed that question by saying, when they've been presented with the information.
Yeah.
When they already know.
Yeah. Again, presenting the information. If it was that simple, and my wife and I talk about this, if simply knowing the information was the reason for you to change, everybody should be changing everything they do. But making behavioral changes is so complex. Okay? We often know what's right for us, but we still don't make that change because it's changing a behavior. And those things are so deeply ingrained and deeply rooted in many other things that it's hard to make that change. That's why I say you have to keep presenting the information and plant the seed, and hopefully they'll hear it again, and then they'll find some other information to support it, and eventually a light bulb will go off, and then they'll make the change. Okay, because there's many, not just about lifestyle and food, but there's so many things in our lives where we know what the right thing to do is, but we don't necessarily do it, right? Because that's not simply the only reason we do something.
Perhaps it's also because there's so much conflicting information coming at us. So how do we make sense of the totality of evidence and really make an educated decision with all this conflicting information?
Yeah, I think that is tough. I think the so much information out there, and there's so much conflicting information that it's hard for people to make
heads or tails of it.
Exactly. It can be very confusing. It does take a critical eye, and you do have to do your research. And again, I keep pointing out, this is all evidence-based. It's scientifically based. It's scientifically proven. There's thousands of articles out there that support whole food plant-based diets and all these things that we're talking about. There's thousands of studies out there that show that meat is bad for you. Okay, and so another thing I point out in some of my lectures is I talk about tobacco. I think it's a good example. Tobacco was advertised by the tobacco companies as being healthy for you. Go back 60, 70, 80 years, they were talking about the health benefits of tobacco, and they had doctors smoking tobacco on commercials and doctors advocating for cigarettes. But the studies started coming out, and there were thousands and thousands of studies that showed the ill benefits, the ill health that tobacco led to, cancer and other things. So finally, in 1964, the Surgeon General was willing to put a label on cigarettes after there were thousands of articles out there that showed how bad tobacco was for you. But before that, the general belief that had been put out there in the marketing and the brainwashing was that tobacco was okay. So similarly, we have thousands of articles out there now that talk about how bad the standard American diet, and in particular an animal-based diet, is for you. There's a lot of brainwashing out there. We're raised from it. The incredible edible egg, just
Milk
all
does
these.
a body good.
Yeah, milk does a body good, and these are just advertising campaigns, but people grow up believing it and taking it to heart. I say it, meat is the new tobacco. Now there are places that are interesting enough. There's, I think, a city in Europe that now has banned meat. And there's other places that are now requiring warning labels on meat. There's some progress and there's some change occurring. there's no doubt about it. Scientifically, it's been proven that meat causes about, I don't know if it's about a dozen or 13 different types of cancers. We know that processed meats for sure are a class 1 carcinogen. And despite that, if I go and query a room full of people, did you know that pepperoni is a class 1 carcinogen? Most people will say they didn't know that because that information's been buried. And it's like you said, there's so much disinformation out there, and there's just so much to make heads or tails out of. All I can say is, you have to educate yourself. You have to be critical about the information that you read. Where did it come from? What's the science behind it?
Now, is there anything that showcases the evidence accurately, or any way to articulate the totality of evidence? I try to do this by saying, well, look at it. The Institute of Medicine says they eat a higher ratio of carbs than, fat and protein while reducing saturated fat, increasing fiber. To me, that's evidence right there, right? And that's a big body of scientists that probably worked to put that together, right? And then you got other things, like you mentioned the World Health Organization, maybe Kaiser Permanente and different, True North has been successful for so long. There's nothing meat-based like this, Hippocrates Wellness, and there's so many things to me that are significant supporting what we're saying. I'm not seeing anything other than YouTubers saying that meat's good for you.
Yeah, I wish there was someplace that there was the totality of the evidence was presented to us and we could say that's the answer. I think that's kind of, those of us who've done our research and where we are, we've come up with the answer for ourselves. But again, there's so much conflicting information and there's so many bodies of knowledge, and there isn't one body of knowledge that's acknowledged. One thing that I will say that's a little bit disconcerting to me is that, we talk about this food plate, and every 5 years the US government comes out with recommendations about the food plate and what should be on it. And that's an evolving product. Every 5 years people go and present information, small body of people comes up and decides what goes on it. But unfortunately, that's influenced by all the different companies out there, and they might, there might be evidence that we show that dairy is bad for you, and that's presented at these meetings. And but there'll be the dairy industry will come in and lobby against removing milk from the plate. Unfortunately, there's so many conflicting interests out there, and a lot of that has nothing to do with health. A lot of it, and unfortunately the majority of it, has to do with money.
Is there anything that can be done about doctors saying, I'm a doctor and meat is good for you, even though the science is contradicting that? I mean, this seems like it's almost criminal to me.
Yeah, that's an area of concern for me. As physicians, and a physician educated in the late 80s, nutrition was not a part of my education. None, zero. Now, I can tell you what a carbohydrate and a protein and a fat are and how many calories are, and I can talk about the Krebs cycle. I can talk about those things at a molecular level. But nutrition itself, what we should eat and what it does to us, was not presented to us. And I think nutrition has evolved since then anyways. But nutrition generally has not been a part of a physician's education. Now, I will say that's changing, and I'm glad to see that. There's more nutrition being presented to our doctors in training today, our medical students. So I think there's an understanding that nutrition is important, and they're beginning to understand that needs to be taught. But I think that also as physicians, we've been told we need to give our patients an answer. Patients come to us and they think that, okay, I need to go ask my doctor. He's the definitive answer on everything having to do with health. So doctor, what should I eat? And then, the doctor's going to give you some answer that's based on his opinion or the way he was raised, okay, or she was raised, and that has nothing to do with evidence-based medicine about what nutrition is, okay. So just being a doctor in and of itself is not proof that they know anything about nutrition. I would rather the doctor say, I don't know. But what they're typically going to do is answer something based on their belief set. But as we've talked about, their belief set is just the same as anybody else's. It's based on the way they were raised by their parents, and culture, and social norms, and what they saw on TV. But again, I think that's changing. And I think that there's more people out there, maybe like me and my colleagues, who are interested. We've gone out and educated ourselves on health and nutrition, and we're seeing it, the education increasing at the medical school level.
Now, the Hippocratic Oath, I mean, if somebody violates that, isn't there any kind of ramifications for that to them?
The Hippocratic Oath is a symbolic thing, okay? And, we all want to say that we, first of all, do no harm. And again, I don't think that they think that they're doing any harm, because they don't necessarily understand the significance of nutrition in health. There are many people out there who don't understand that. And the funny thing is we all know deep down inside how important it is, but that we tend to put all that stuff in a black box and tuck it away somewhere in our mind so we don't have to pay attention to it. Again, because there's so many, just the knowledge itself doesn't make you change. There's all those things that impact our behavior that have to be addressed in order to affect change.
Do you have any regrets?
I regret that I didn't become plant-based sooner. I really do. I look back and go, okay, well, what could I have done differently? What would have made the light turn on sooner for me? I was living a particular lifestyle that I thought was extremely healthy. So why didn't I see or know about all of this stuff? And so if I wasn't able to see that, I can understand why there's so many out there who are just living their lives day to day and they aren't seeing it as well. So that's one of my big regrets, is not being whole food plant-based earlier in my life.
Normally I ask, why didn't you do that sooner? But you may have already answered that.
Kind of, yeah. I thought I was doing the right thing. I think we all do. We're all doing the best we can until we learn something new and change it. I look back and I'm trying to say to myself, why didn't I see it?
Do you think if you thought about it long enough, you might regret the effect this might have had on your patients, even not doing this sooner?
Well, I don't necessarily know. I've always done the best I can for my patients. And now that I've learned something else, giving and presenting that information, I think it's an ethical responsibility for me to share with my patients that I believe this is a healthier way to live. I have to share this with you. So I do, okay? And there's a lot of people who think I'm wasting my time, but because they're not going to change, I do share it with them. And this is funny because when I first changed 5-6 years ago, people were calling me the crazy doctor. You're crazy. You're a vegan. What are you doing? And now in my community, I'm the healthy doctor. So it's come full circle now that I'm not crazy anymore. They recognize that it's a healthier lifestyle.
Do you feel like you're more successful with your patients now?
Not necessarily. It's had an impact on me in the sense that I feel more fulfilled. I'm not just plugging holes and putting out fires. I am doing that, but I'm also addressing the root cause of their disease. And so I feel like I'm more of a healer now rather than just a repairman, okay? And so I am treating the patient at a more holistic level, and I am more concerned about their health, okay? Hey, I'm not just, you got a blockage in your artery, I'm putting a stent in, see you later, okay? I'm gonna put that stent in and help your leg feel better or try to save your leg, okay, and heal the gangrene. But here, let me teach you about a better way to live. And so that makes me feel better. My patients have varying levels of receptivity to it. I acknowledge that and accept that. And again, it's for all those reasons we talked about. I try to be very realistic about it, but continue to spread the message.
Now, maybe if you think about it, maybe there could be, you're seeing patients have to come back to you for additional procedures maybe, or maybe your patients are having to take less medications. Is there any of that going on?
Yeah, no doubt.
So maybe you are having more success.
Well, yeah. I guess maybe the success is underwhelming to me because I'd love to see it in everybody, okay? But no doubt. I have patients who lose weight, who get off their diabetes medications, whose blood pressure improves. And these are kind of the risk factors for atherosclerosis. So I'm seeing that those particular patients who embrace the concepts, there are tremendous improvements in their lifestyles.
Okay. You have any success stories you want to share?
Well, I have a few. There's one interesting story. It was a young man. It's funny how my concept of what's young. When I was a 30-something-year-old vascular surgeon, a 52-year-old was old to me. Okay, and now a 52-year-old is young to me. So there was a young 52-year-old guy, which is a young age to get atherosclerosis. As an aside, When I first started this, most of my patients were in their 60s and 70s. Fast forward 25 and 30 years, it's not unusual for me to see people in their early 60s and in their 50s, sometimes even people in their 40s. So as our diet has gotten worse in this country, people are getting disease at an earlier age. So it's a trend that there's no doubt I've seen, and it exists. The disease is presenting itself earlier and earlier, which means people are going to have lots of problems and die younger too. But anyway, to get back to this, a young 52-year-old gentleman comes into my office and he's had a mini stroke. And I diagnosed a carotid artery problem. He had a severe blockage of one carotid artery. It was about 90% blocked. That's bad. That's really bad. That means that he has a very high risk of having another stroke, and who knows if that's the big one. His other side didn't have much blockage. Okay, so we always check both sides. And so I saw him in the office, and I told him that we're going to have to fix this carotid artery, and it's going to require a surgery where I have to make an incision on his neck. And it's a big deal. I mean, people do very well, and we're very good at what we do, and very low complications. But you're operating on the artery going to the brain. That's a scary, scary thing. On one hand, it's one of the most satisfying operations I do, but on the other hand, it's one of the scariest operations I do. And so I was talking to him about it, talking about the risks of the surgery, the benefits of the surgery, the details of the surgery. And he accepted that he needed to have this done in order to prevent him from having another stroke. But one thing he asked me, and he was very sincere, he said, "Doc, what can I do? I recognize that I'm a young guy and I've got a long life to live, hopefully. What can I do to prevent that from happening on my other side?" And I said, "Well, funny you should ask. Well, let me talk to you about your lifestyle." He had high blood pressure, he had type 2 diabetes, and his cholesterol was high. And he was also overweight. He wasn't morbidly obese, but I would say he was about 30 pounds overweight. Okay. I tend to recommend people be on the lighter side. I think there's a lot of implications for health and aging if you're lighter. Okay, we definitely know that. There's lots of studies to show that. Anyway, so I talked to him about lifestyle, and in particular the diet. I also advocate, getting sleep, and advocating for spirituality and meditation, and getting good exercise. Those are other aspects of lifestyle. But in particular, I wanted to address his chronic diseases through nutrition. So we spent a little time on talking about nutrition. I have handouts in my office. I gave him that point to resources, not only my website, but that I run with my wife, but also other resources on the web about things, and even recipes and stuff like that. Now, I've had this discussion dozens and dozens, if not hundreds of times with my patients. So I wasn't expecting anything. But his surgery was scheduled almost a month later, exactly a month later. And when he gets checked into the hospital, and I'm at the hospital. So the first meeting was at my clinic. So this next meeting's at the hospital, and I go to see him before the operation, and I pull the curtain back, and I don't recognize him. Thought maybe I had went into the wrong patient room. Okay, and I said hello, and he says, "Hi, Dr. Bukhari," and it was him, but I didn't recognize him because he was skinnier than he was a month ago. And when I started talking to him, he said he walked out of the office and he went and cleaned out his pantry, and he went to the store, and he immediately went whole food plant-based. That's how scared he was about what was going on. Oh, and I had also talked to him about, going whole food plant-based is going to make him healthier for the surgery itself. Okay, I had embraced it from that very day. And so we're talking about 4 weeks, maybe 30 days. He'd lost over 20 pounds. His blood pressure, he was hypertensive in my office. His blood pressure on check-in was normal, although granted he was still on blood pressure medications, but he went from being hypertensive on medications to normal. His blood sugar, he was on a medication for type 2 diabetes, but his blood sugar was normal. And his cholesterol had dropped from 280 to it was under 200. Okay, and that was just in 4 weeks. So all those things just, I was just shocked at the transformation because I hadn't seen that in one of my patients. And I went ahead and did his operation, and he did well. And in follow-up, he continued to adhere to the lifestyle. And over the course of the next few months, he stopped having to take medication for his diabetes. He stopped having to take medication for his cholesterol. And he stopped having to take medication for his blood pressure. That's one of my most recent stories that has had an impact on me. And I go, okay, well, it's like you just said, yeah, sure, we've had some successes. I'd like to see that in all my patients, but that was a good one. Yeah, and so I think he's done the work. He's done the work that's going to minimize his risk for having future problems. Now, again, it's not a panacea.
He may have to come back and get a stent or something one day.
Well, eventually he's going to die of something. I just hope now this 52-year-old lives to be 90 and lives a long, healthy lifespan in that time, rather than living the last 20 or 30 years with chronic diseases in and out of the hospital, having multiple procedures, spending all of his money on health care instead of retirement and traveling the world.
Furman, he says, we're designed to live long and die fast. I love that quote, which is my next question. Do you have any quotes you want to share?
Yeah, I was quoting the very common one, let food be thy medicine. And I think that if we live our lives that way, we're going to be healthier for it. The other one I like to talk about is you cannot exercise away a bad diet. Okay, those are the two I use all the time.
I'm so glad you said that. I have friends, they'll get to where they're like overweight or something, and the only thing they'll do is start exercising. To me, that's like dangerous. Is it dangerous to exercise first and not change your diet, or is it better to change your diet first and then maybe exercise? You know, is there a
I don't know
way?
that it's necessarily dangerous to exercise when you're overweight. I think it's probably harder. I think that the people who think that exercise is going to be the end all, they're wrong. Even back in my days pre-plant-based, when I was exercising a lot, I used to do this thing called P90X. And I was a P90X addict. It's an exercise program by this well-known exercise guy named Tony Horton. It was very intensive workouts, but one of the things that he said, and I had never thought about it this way as before, is that he said 80% of this program is not exercise. 80% is the food you eat. Okay, and that's the first time I'd ever heard an exercise guy talk, not saying his exercise was the most important thing. And I began to understand that part of a healthy lifestyle is both food and exercise, but the food is going to be the primary determinant. Okay, and so that's where my belief set started with. You can't exercise away a bad diet. You can't eat pizzas and hamburgers and hot dogs and drink beer incessantly and all the time, and eat Whataburger and all these things all day long, and then think you're going to go to the gym and exercise a little bit, and that's going to go away. A true healthy lifestyle comes from primarily your nutrition, and then add appropriate exercise in there.
Is there any way, like, if somebody wants to learn more about you or reach out to you, that they could find out more information about you? You mentioned a website. You want to plug that real quick?
My wife has a very nice podcast. She's done well over 200 episodes on plant-based nutrition and lifestyle. It's called Healthy Lifestyle Solutions. The podcast itself, she's on all of the major platforms. And also, if you sign up on our website, there's a free download of my cardiovascular disease and nutrition PDF. I think it's about a 40-page PDF that we've designed and has great starting information. It's a lot of what I've talked about today, some basics about health and nutrition and cardiovascular disease, some recipes, a lot of links. So it's a nice little resource.
Are you familiar with whether or not the Orange program is Medicare funded?
It is, and I'm very, very happy about that. So the Orange program is a very, very specifically designed cardiac rehab program. It's called Intensive Cardiac Rehab, ICR, as opposed to the traditional cardiac rehab. Traditional cardiac rehab is nothing but an exercise program. Patients are given a script, they go 3 times a week for 12 weeks, and all they do is get on a treadmill. It's just supervised exercise. That's it. Now, there may be some benefit to that, but the Ornish program, and there's also one called the Pritikin program. Okay, I don't want to leave it out because they're both Medicare approved, and they're both really effective. What they are is intensive lifestyle changes. Okay, they involve both exercise, so there's 36 exercise components to it, but there's also 36 classroom components to it. And those classroom components talk about changing your lifestyle. It gives you cooking classes, it talks to you about exercise, it talks to you about sleep and meditation, and it really addresses many of these behavioral aspects of our lifestyles that need to change. Okay? Again, you can't just exercise away your problems. You've got to change your lifestyle. So the intensive cardiac rehab is 72 sessions. And literally it's 36 2-hour sessions. One session is the classroom, one session is the exercise. And they've shown that this is a very effective, and they do about 3 a week over 12 weeks. This is a very effective way to not only get some supervised exercise in, which hopefully will help you change your habits, but it also has all that classroom work that helps you learn more. And the more you learn, the more information you get, the more you can address your root problems.
If somebody wanted to see somebody that can implement this program,
Vascular patients can benefit from this, and there is Medicare and insurance coverage for it, which is one of the main barriers for patients. They won't do it if they have to pay out of pocket because they can't afford it. But if insurance covers it, if Medicare covers it, they'll do it. So yes, you can go to your heart specialist, you can go to your vascular surgeon, and you can ask them about whether they qualify. There are certain qualifying diagnoses that you have to have, all heart and vascular related. If you are a heart patient or you've got vascular issues, there's a good chance that you'll qualify for it. And so yeah, I would recommend go to your heart doctor and talk to them about it. Don't just go to the regular cardiac rehab program. You want to ask for an intensive cardiac rehab program, either an Ornish program or a Pritikin program.
Those were able to become Medicare approved by evidencing this.
Yes, it was based on, so both of these entities, the Ornish entity and the Pritikin entity, both submitted piles of their own data as well as the data that existed out there in the scientific community and presented it to Medicare. Medicare reviewed it and said, you're absolutely right. It's scientifically proven that this is a benefit to cardiac patients or heart patients, and so we're going to pay for it.
Anything else? Like, to me, that's very significant. Like, that's in and of itself very convincing, right?
Yeah, it's huge. It's huge.
Yeah.
And something that surprises me, it's a shame that only 10% of the patients who qualify for this actually avail themselves of this opportunity. There's a lot of room to grow, a lot of people we can help if we can get them into this.
So we just need to raise awareness. Is there any epic studies or anything that really are convincing to you that you can throw out there for those that want something to kind of back this up?
You know, so I don't point to any just one study. Again, one study doesn't prove anything. Okay, I think you get trends from studies. I call it the body of knowledge. Okay, the preponderance of the evidence. Okay, and there are hundreds, if not thousands, of studies out there that. What I do like to say is there's thousands of studies that show about the bad health effects of the Western diet and of meat and dairy and eggs. Okay, but there's no studies out there that show that eating a diet full of grains, legumes, fruits, and vegetables is bad for you.
And then, is there anything that we didn't cover that you would like to get out there?
I could probably talk for days about everything. No, but I think we've covered a nice breadth of stuff.
And to close it,
what I like to say to people is that I'm trying to teach people how to live a healthier lifestyle. I don't expect everybody to live my lifestyle. I think that there's a variety of places that people can land. What I'm hoping is to teach people that there are healthier ways to live, much better than our kind of standard American diet that we have kind of come to rest upon over the last few decades, which is continuing to get worse. What I'd like for people just to do is to just incorporate a few new healthy things into their life and crowd out some of the unhealthy things. Studies show that just eating 1 or 2 more servings of vegetables and fruits a day results in a 10 to 20% improvement in your health. So something as simple as that. So you don't have to be 100% whole food plant-based like me, but if you add 1 serving of vegetables and 2 servings of fruit a day, you're going to be healthier for it. I just want you to move the needle in that direction. And you never know, when you start to feel good about what you're doing, you tend to keep going in that direction.
Do you believe at all that moderation kills?
I'm not a big fan of that term, all things in moderation. I do believe that you have to take a stance and decide what's right for you and then apply it. So it's not like, okay, moderation in alcohol, moderation in meat, moderation in my weight, moderation in my exercise. No, I think that you need to decide what's appropriate and healthy and attack that full force. I do think that our health is something that deserves our attention. Okay, it's not necessarily easy. Okay, It's easy to go to the convenience store and buy something because it's called a convenience store. And it's easy to go to the fast food place, restaurant on the corner and get something off their dollar menu, okay? But it's not necessarily healthy, okay? So I think that just anything worth having is also worth working for. Planning your meals, doing the shopping for it, exercising, planning your lifestyle so that you get the appropriate amount of sleep, okay? These are things that we want, if we find important, then it's worth putting some effort forth to it.